Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mr. Sanders, your primary care doctor has informed me that we need to take a closer look at the medications you are currently taking for your rheumatoid arthritis.
Yes, that's correct.
Can you give me some more details about your arthritis? When did you start noticing symptoms?
My first major flare-up happened 2 years ago. My wife and I were at a family gathering, and I suddenly noticed severe pain and stiffness in my right hand. I've always thought arthritis was something that mainly affected the knees or hips. I also thought it was an old person's disease, and I'm only 45. Initially, I thought maybe I'd injured my hand during some DIY work at home. My wife even speculated it might be a reaction to the blood pressure medication I'm on.
That seems unlikely, I'd say.
Regardless, the pain just continued to get worse. I began to worry it could be a symptom of something more serious, as the pain was unbearable. My wife decided we needed professional help and called our local clinic to describe my condition. The clinic advised us to come in. I was in such pain that driving was out of the question. I was even struggling to walk from our home to the car. When we reached the clinic, the doctor examined me and decided to run some blood tests. She expressed concern that it could be a severe infection, possibly septic arthritis, which really frightened us. But after about an hour, she confirmed it wasn't an infection, but likely rheumatoid arthritis. Despite the diagnosis, we felt a sense of relief that it wasn't something more dire.
Understandable.
The doctor then asked if I'd ever experienced anything like this before. Thinking back, I realized that I'd had minor stiffness in the same hand after playing golf during the summer, but I'd always chalked it up to overexertion or a minor injury. This new pain was much more severe, and it didn't seem related to any physical activity. I've had multiple flare-ups since that first incident.
I see. And what medications have you been prescribed so far to manage the pain?
Initially, the doctor at the clinic recommended non-steroidal anti-inflammatory drugs, but I didn't notice much improvement with those. During my next flare-up, I visited my GP who prescribed something.
Methotrexate?
Yes, that's the one. It helped with the pain, but it made me nauseous.
Yes, that can be a side effect.
It was so unpleasant that I vowed never to take it again. After a particularly severe flare-up, my doctor suggested a stronger painkiller, tramadol. It did help with the pain, but it made me drowsy and disoriented.
Right? Did you try any other type of treatment besides medication?
My GP suggested heat therapy, which did help somewhat, but it's not practical to use all the time. Later, she recommended trying sulfasalazine, Unfortunately, that didn't work out either. It gave me a skin rash, so she advised me to stop taking it and referred me to a specialist, which is why I'm here. Do you think there's more that can be done?
I'm confident we can.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mr. Johnson?
Yes, that's me.
I'm Dr. Wright. I apologize for the delay. Now, could you please tell me what brings you here today?
I recently got back from a business trip in Africa, and I haven't felt right since I landed. At first, I chalked it up to jet lag, but the symptoms persisted and even got worse. I've been having high fevers, severe headaches, and muscle pain. I thought it was the flu, but it's way worse than any flu I've ever had. When I spoke to my regular physician and mentioned where I had been, he mentioned the possibility of malaria, even though I had been taking doxycycline prophylactically. I guess there are strains that are resistant, so he gave me a different medication.
Do you remember the name of that medication?
It was something like quinine and doxycycline.
Correct.
I've taken that for the last 3 days, but I haven't seen much improvement. In fact, my condition has worsened. I've been feeling really fatigued, and I've been sweating excessively. I've been vomiting too, and nothing seems to stay down. My doctor called and said the malaria test came back negative, but if the symptoms persisted, I should go to the emergency room for further tests.
Understood. Let's do a brief checkup. Your skin color seems normal. I see no signs of jaundice. Your breathing sounds fine as well. Have you experienced any shortness of breath?
No, but I did notice my heart was beating faster than usual.
I'm noticing some of that currently. Have you noticed any other symptoms?
Well, my eyes have been really itchy and dry. It feels like there's something gritty in there.
Have you had any abdominal discomfort?
No real pain, but with all the vomiting, I don't have much of an appetite.
Before your trip, did you get any immunizations?
I did. I got shots for typhoid, hepatitis A, and yellow fever. I didn't have any adverse reactions to those. While I was on the trip, I did have an outbreak of cold sores. I've had them in the past, so I used an over-the-counter cream. I was otherwise healthy during the trip. In terms of my medical history, I had a heart surgery a few years ago in 2016 for a blocked artery. I was put on aspirin and statins for a while, but I don't take them anymore.
It's possible that this could be a reaction to certain medications, but we need to run some more tests to make sure. We will try to figure out what's going on and help you feel better.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
when you compare the prognosis of cancers detected early with those identified at later stages, you'll see a drastic contrast. Clearly, our most significant impact can be in improving the odds through early detection and intervention. Our 5-year survival rates are impressively high for patients whose cancers are identified early, as high as 90% compared to the national average of 67%. Many of our patients are seniors, which inherently puts them at higher risk. And by the time they come to us, we usually don't have much time to start intervention and reduce risks. Every hour, every minute we can use to initiate treatment matters. That's because the patients we are dealing with are more likely to have post-treatment complications due to associated heart, kidney, and lung conditions.
Now look at question 26.
How are you feeling post-surgery, Mrs. Turner?
Quite tired, but the medication is working. I don't feel much pain in my back, just as you said.
It's normal to feel a bit drained after a procedure, but your operation went well. We managed to successfully remove the herniated portion of the disc. You're cleared to go home.
Thank you. I had a similar procedure on another disc a few years back, so I'm familiar with the process. Still, it amazes me that this is all done in a day.
You'll need to take it easy and avoid strenuous activities for the first 2 weeks. You should notice improved mobility within a month. However, it will take about 6 months before you should consider any heavy lifting or high-impact activities.
6 months? Last time I resumed normal activities within a couple of months. But now that I recall, I did have persistent discomfort for some time afterwards.
Yes, when your body sends pain signals, it's usually telling you to slow down and give it time to heal.
Now look at question 27.
Hi, I need to schedule a follow-up appointment as soon as possible, please.
Sure. Can you tell me who your regular physical therapist is?
It's Dr. Benson.
Is it urgent? Are you feeling a lot of discomfort?
Yes, it's my knee, the one Dr. Benson worked on last Tuesday.
I see, but Dr. Benson is not available today. However, we have an opening this afternoon with his colleague, Dr. Morgan.
That should be fine. But did you mean Dr. Benson could see me tomorrow?
Yes, he has an opening first thing in the morning. Can you manage till then?
Well, I've been avoiding putting weight on it and taking ibuprofen, which seems to be helping. The discomfort began while I was doing my prescribed exercises, so I'm concerned I may have aggravated Dr. Benson's treatment. It makes more sense for him to evaluate it.
All right. We'll schedule your appointment for tomorrow morning at...
Now look at question 28.
As you know, You've all been asked to participate in the survey regarding our plan to implement telehealth services, and I'm sure each of you has thoughts on how this might affect your daily responsibilities. You're likely familiar with the data showing the potential benefits of telehealth, such as increased access to medical services and patient convenience. We fully understand these advantages, but of course, the transition has to be managed efficiently. I've picked up on your concerns about the additional workload, that you're already quite busy and might not be able to handle extra tasks related to this service. However, we've designed a comprehensive plan to prevent you from being overwhelmed with additional duties. Patients will receive detailed instructions about how to use the telehealth service, and the management team will keep a close eye on things to ensure normal operations are not disrupted.
Now look at question 29.
It seems like Mr. Smith is still slightly disoriented after his coronary bypass. When will he be moved to his room?
He should be transferred in the next half hour. I'm about to call for patient transport services.
Good. I've added some additional post-op investigations. He might experience complications due to potential kidney stress. His heart was considerably strained, and we administered a good amount of contrast. I want his renal function checked every 12 hours. Also, look out for any changes in urine output, sudden breathlessness, or swelling in his legs.
All right, I'll make sure a note to watch for renal impairment is handed over to the ward.
Okay, if there's anything unusual, don't hesitate to call me.
Now look at question 30.
Today we're focusing on Lisa. She's 3 weeks post-operation for a total hip replacement. I think this is her first post-op rehabilitation session, right?
Yes, that's right.
Okay, so today we're starting with a low-impact aquatic therapy. It will allow Lisa to exercise without placing too much stress on her new hip joint. We'll be progressing with each session to get her back to a point where she can fully participate in her daily activities. Movement and controlled resistance are critical to her recovery, and the water buoyancy should also help reduce her pain and facilitate her muscle re-education.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today we're joined by Dr. Linda Patterson, who specializes in helping patients manage chronic pain conditions. Chronic pain is something that affects millions of people worldwide. Linda, in your experience, what tends to be the biggest challenges for those living with chronic pain?
The challenges can vary greatly from person to person, depending on the severity of the pain, the nature of their condition, and the individual's personal life circumstances. However, one common theme that emerges is the impact of chronic pain on a person's ability to function in daily life. Activities that most people take for granted, like grocery shopping, driving, or even getting dressed in the morning, can become incredibly challenging. It's also important to remember the psychological impact. Living with constant pain can lead to feelings of isolation, depression, and anxiety.
One of the most common types of chronic pain is low back pain. Can you talk a bit about the prevalence of this issue and what can be done to manage it?
Low back pain is indeed a widespread issue. In fact, it's one of the leading causes of disability worldwide. There are a variety of treatment options available, ranging from physical therapy and exercise programs to medications and, in some cases, surgery. However, it's essential to remember that what works best can vary significantly from person to person. One promising area of research is mind-body interventions, such as mindfulness-based stress reduction and cognitive behavioral therapy, which have been shown to help some patients manage their pain more effectively.
That's interesting. And could you talk a bit about the stigma that can be associated with chronic pain conditions and how that might affect patients?
Yes, unfortunately, the stigma associated with chronic pain can be quite significant. Despite the very real physical suffering these patients experience, there is often a lack of understanding or empathy from others who might see them as exaggerating their pain or seeking attention. This can lead to feelings of isolation and can even affect their medical care, with some healthcare providers underestimating the severity of their pain. One of the things we try to do in our practice is to provide a supportive environment where patients feel heard and understood.
And I understand that you're involved in a research study looking at the use of virtual reality for chronic pain management.
That's correct. The idea is to use virtual reality technology to help patients retrain their brains to process pain signals differently. Participants wear a virtual reality headset and engage in a variety of activities designed to stimulate different senses. Early results have been promising, with some participants reporting a reduction in their pain levels after participating in the program.
That sounds like a fascinating approach. And this research is ongoing, of course, so we'll have to have you back to discuss the results once they're available.
I'd be delighted to. Thanks for having me.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Dr. Lisa Baker, a gastroenterologist, and today I'd like to discuss a condition known as Crohn's disease. Crohn's disease is a chronic inflammatory condition that can affect any part of the digestive tract, although it's most common in the small intestine or the colon. The main symptoms include abdominal pain, diarrhea, and weight loss. More severe cases may result in complications like abscesses, fistulas, or even malnutrition. It's estimated to affect about 700,000 people in the United States alone. The cause of Crohn's disease is still not entirely known, but it's thought to be a result of a combination of genetic and environmental factors, leading to an inappropriate immune response. Smoking and a family history of the disease increase the risk. It's also important to understand that Crohn's is not caused by eating specific foods or stress, although these can exacerbate the symptoms. Let me share a case of a 27-year-old male, Alex, who had been experiencing chronic abdominal pain and weight loss. Upon examining his medical history, I learned that his mother had a similar condition in her 30s. Recognizing the hereditary nature of Crohn's, I recommended Alex for further testing, and we were able to diagnose him with the disease. Crohn's disease has a significant impact on patients' quality of life. Chronic pain, multiple hospitalizations, and surgeries can lead to psychological distress, including anxiety and depression. I recall a young woman, Jessica, who was diagnosed with Crohn's in her late teens. She had to cope not only with the physical pain, but also the emotional burden of managing a chronic disease at such a young age. When it comes to treatment, we have several options ranging from anti-inflammatory drugs to immunosuppressants, and in severe cases, surgery may be required. However, treatment is always tailored to the individual's specific symptoms and severity of the disease. Some patients find that certain foods can trigger their symptoms, and so dietary changes can sometimes help manage the condition. As a gastroenterologist, I stress to my patients the importance of regular checkups and follow-ups. Crohn's is a lifelong disease, but with the right care and treatment, patients can live fulfilling and productive lives.